For our third and final panel, I'd like to have Mr. Kevin Magada, President and CEO of Real Alternatives, to introduce our next panel.
Thank you so much, Senator Ward. As I had explained before earlier, our program does not fund medical services. We do not fund any of the services such as sonograms or STD testings or tests of that sort. However, some of our centers do provide that as an additional program that they, of course, can provide as a separate 501c3 organization. So what I have here is staff from Morningstar Pregnancy Services in Harrisburg. They are one of our centers that also provide medical services, and I thought it would be good for people to hear about the standards that they do operate with, since there are some questions about it.
First, we have Dr. Mary Beth Higgins, who is the medical director at Morningstar Pregnancy Services. Can you just share with us a little bit about what services you provide and as the medical director, how you fit into the program?
Sure. Thank you so much for having
us.
Thanks for being here. We really appreciate that. Like I said, I'm Mary Beth Higgins. I'm a board certified OBGYN. I've born, raised, educated in Pennsylvania, and I'm now proud to be medical director of Morningstar Services. We provide the counseling as you spoke about. We also have the added benefit of performing ultrasounds, which Lori will be able to talk to you about, provide the counseling, the STD examinations, and also treatment, as well as many other services. My role, I'm the medical director, so I'm responsible for all medical care and oversight of that. In charge of oversight of the counselors, the nurses, the ultrasonographers, and as well as the radiologists, who we actually have board certified radiologists interpreting our ultrasound films. So a little bit of a broad scope, but in charge of all medical care.
Mm-hmm. Excellent. Next.
So you coordinate with your other members within the facility. And Lori Walmer, you are the registered diagnostic medical sonographer at Morningstar. So when you're performing a sonogram, what other information do you provide to the clients?
Some women who come in may have taken like a home pregnancy test, maybe had a positive test. Other ones may be experience symptoms that are commonly associated with pregnancy. So they might like a confirmation or just, am I pregnant or am I not? So we offer them a pregnancy test that they may take while in the office. If it's positive, we will give them a limited ultrasound, and they will be able to see how far along they are. Oftentimes, they are not as far along or further along than they might think that they are. So ultrasound gives us a definitive gestational age, how far the pregnancy is, the viability of the baby, and if we see any kind of incidental findings that are of concern, we would refer that patient on to our medical director for further care.
So that gets into another question I had regarding, how it's helpful in recognizing the possibility of like an ectopic pregnancy. And so how would you proceed, or the value in that, number one, and then how you would proceed?
So an ectopic pregnancy is a pregnancy that has implanted somewhere other than the normal uterine location. An ectopic pregnancy cannot continue outside of the uterus and can cause damage to the woman's surrounding organs, blood loss, or in rare cases, death. So it's a serious condition. Because of early ultrasounds, ectopic pregnancies that are suspected by the RDMS and then reported by the radiologist would be immediately referred to the emergency room for further evaluation and care.
And that's where Dr. Higgins would
Yep.
come into play.
Exactly.
Okay. Well, thank you. And Steve Morris is the manager of the Morningstar Pregnancy Center. Welcome, Steve, and thank you. So as a provider of medical services, could you discuss your confidentiality policy for your facility?
Sure, definitely. Thank you for having us here today. Yeah, my name is Steve Morris. I'm a registered nurse. I'm the nurse clinic manager of Morningstar Pregnancy Services in Harrisburg. I've worked in the healthcare field for 7 years. During my nursing education, I worked as a pharmacy technician and as an emergency department clinical assistant. And as a nurse, I've worked in emergency and critical care nursing prior to my current role at Morningstar. And so, as you alluded to, my current role at Morningstar, I'm in charge of the STI testing program, and I'm also the HIPAA compliance officer for the center. So in order to maintain confidentiality, we follow HIPAA, right? So our policy is that all clients will be protected from disclosure of information that would violate their right to privacy, except in cases where disclosure is required by law, such as in cases of child abuse or prevention of self-harm. So we maintain client confidentiality in all communications as outlined and in compliance with HIPAA. We utilize an access-controlled health record system, and information is only released to third parties once we've obtained written consent from a patient per our authorization of release of health information. So overall, we comply with HIPAA, and we hold ourselves to the highest standards for maintaining confidentiality in order to maintain patient trust and a high level of quality of care.
Now, you did use some acronyms in there, so not everybody watching might necessarily know what those are. So I know you provide the sonograms at your facility. What other medical services do you provide?
Sure, thanks. So in addition to ultrasounds and lab quality pregnancy tests, we provide referrals for primary care and OB services, mental health services, assistance with obtaining help from social programs such as Medicaid. We also provide STI testing services for gonorrhea, chlamydia, syphilis, and HIV. We tested over 600 patients last year and treated over 100. We have a long-standing relationship with the Pennsylvania Department of Health. We consult them fairly frequently, and they're glad that we're there because we have a really good follow-up and retention rate with their clients. Let's see, the STI testing program is extremely important to our center, especially considering there's a really high prevalence of, or an increasing rate of congenital syphilis in the U.S. So in order to help address that, at all of our pregnancy visits, patients have STI testing, including syphilis and HIV testing, available to them.
Okay. And in your coordination of your program with the Real Alternatives, so these are two different programs that are running simultaneously in the Morningstar Pregnancy Services Center, correct?
Yep, that is correct, yeah. So our counselors are able to meet and counsel with patients and are able to bill and be reimbursed by Real Alternatives, and then they can come right next door and get STI testing in the same visit.
It's almost one-stop shopping.
Yep. That's the idea.
But thank you.
I'd like to share a story about how ultrasound has made a difference. So they say a picture is worth 1,000 words. This statement became very evident to me through a recent client interaction. The patient revealed to me prior to the ultrasound that she had experienced an abortion in the past and that it was an awful experience that she never wanted to go through again. She was now pregnant again and wanted to parent this baby. The ultrasound showed a 9-week baby with arms and legs moving and a strong heart beating. I didn't know what was happening. The mother began sobbing, and she explained to me that her abortion had occurred also at 9 weeks, but that she had no idea that the baby had arms and legs and a beating heart. And she told me that if she knew the truth about what the baby looked like, she could have never had the abortion. We've been offering ultrasounds at our clinic since 2002, and about 80% of women who come to us and are at risk for abortion choose to continue their pregnancy after an ultrasound. So ultrasounds are very important for the women to be able to make an informed decision.
Absolutely, and that is a huge part of the whole process, and I think something that each woman deserves to see to help them with their decision.
I also have a client story to share. That'd be okay. So at Morningstar, we strive to provide evidence-based, patient-centered care that meets the needs of the women that we see as a whole person, that empowers them and recognizes their dignity, and empowers them to make a truly informed pregnancy decision. So a recent case a couple months ago that I feel like really demonstrates that. A patient came to us stating an intention to seek an abortion. She was recently arrived in the United States. She was recently married, although there was some question as to whether or not she'd been compelled to enter the marriage in the first place, and she was newly pregnant. And so, when meeting with her, our counselors determined that her family was pressuring her to terminate the pregnancy. That's not what she wanted to do. She wanted to continue the pregnancy. So, after discussion with our counselors, it came out that she was facing home insecurity. They were not going to allow her to return to her residence if she didn't abort. And so she was feeling pretty overwhelmed and wasn't sure where to turn. And so through working with my team and I, we were able to get her established in OB care for the duration of her pregnancy. And we were able to get her into a safe environment. And so, that it almost sounds like a story that echoes some of the other ones that we've heard today. But I think it just goes to show how prevalent these issues are that affect women that we see in our centers, and how important the work that we do is in order to truly empower them.
Very powerful. That's really quite a story, and we appreciate you both sharing your stories with us. So this marks the end of our symposium here today. I want to thank our panelists here and all who came to answer questions and shine a much needed light on the invaluable work that pregnancy support centers do across our Commonwealth. Women who are going through the uncertainty and vulnerability of an unexpected pregnancy need our help. Centers like the ones we've heard about today are some of the best tools that we have to reach these women and provide support. Representative Kiefer and I hope to work with our colleagues in the General Assembly to support these and similar programs and create a statewide safety net for all pregnant women and new mothers who need it. I want to thank you all again for coming, and God bless you all.